Okay. And then we practiced this earlier today, but I'm going to attempt to spotlight the panelists. So they'll be the people that are up on your screen. Oh, there's me. Oh, one more. All right, I think that worked. Does that work for everybody? Yes. Okay, so welcome to the community support panel, and I'm Carina. I'm a senior. She, her are my pronouns. And so the purpose of this panel is to just discuss the numerous ways Macalester provides mental health support across campus. And I sort of just wanted to start it off by acknowledging that our three panelists here are from three different departments, but they're not the only three departments at Macalester that provide support, but they're just the three that are on this panel right now. So I just wanted to acknowledge that. So we'll just start off with introductions, just who you are and what department you're from. And I'll just go to the person to my right, which is Melissa.
Hi, everyone, and I just want to thank you for Carina for inviting us to this. My name is Melissa Fletcher. I use she, her, hers, and I'm from Disability Services.
And below her, we have Kyle.
Hi, everyone. My name is Kyle. I use he, him as pronouns, and I'm the Associate Director of Residential Life First Year and Second Year Experience, and I'm excited to be here with you all today.
Then last but not least, Julia.
Hi, my name is Julia. I use she, her pronouns. I'm the Assistant Director and Care Coordinator for Counseling Services in the Hamry Center. That is a mouthful, but that is my title.
So to start it off, the panelists sort of briefly prepared something they want to say about how their resources work, what they do, and how they sort of support students in terms of mental health. So we'll start with Julia.
Sure. So that is a big question. I'm going to try and be really small and short and direct about it. But the way in which we think of mental health on campus is we kind of think of three different branches of a tree. So there's kind of acute or immediate supports. There are short-term supports, and then there's connecting to long-term supports. And we try and provide resources that kind of connect under each branch. So those kind of short-term immediate supports would be things like Press 2, which is our 24-hour phone support. It would be a same-day drop-in. It might be kind of contacting our front desk and connecting with additional off-campus supports like urgent care for adult mental health or connecting to an emergency room. Short-term counseling is kind of a lot of what we do on campus. So that might be one-on-one counseling for a shorter period of time. That might be a counseling group. That might be working with a provider to get certain resources or skills around campus, things like that. And then long-term support is more that idea of finding specialized support or consistent care that would last for a longer period of time. So typically beyond like a semester, really. So some students come in and they say, I want to meet with a provider every Tuesday morning. That would be considered a long-term support system. Or I really want someone who will help me focus on my alcohol or drug dependency. Okay, we can definitely support you in finding that kind of long-term specialty care off campus. And we would work with students around finding that long-term care. So that's my very short, quick answer. I think we're going to have time to go into more detail about those. But when we think about support and care on campus, those are really the branches that we look at. And then again, because we're on this beautiful panel, you can tell that there's other kind of departments and spaces on campus. And one of our kind of roles or jobs on campus is to connect students to resources that might make more sense than working with a counselor, or that might be a great bridge with the care that they are receiving in our department. So we work a lot with Kyle and Melissa, as well as other departments on campus to find that holistic support for students.
That was great. And we definitely will come back to that as some of the questions pertain to that. And so then we'll shift over to Melissa for your how you support disability services support mental health students and things on campus.
Yeah, thanks. I mean, I think that there's some, in terms of our office, that there is sometimes misunderstanding in terms of what we do. So the first thing I want to say is that we've been looking really globally at what our office does and even how that shifted with the pandemic, especially because a lot of people have been impacted, of course, due to the last year and even more than that. So a real simple thing that we're doing is we're just starting by looking at a name change to be more inclusive. So it's not just limited to students who may have a diagnosed disability. I want to be really clear that's not the only thing that we do. But we really have 4 different areas that we look at. And one of them is access, and I'll talk a little bit about that. The second one is really educational pieces. The third one is doing advocacy. And the fourth one that's really been increasing a lot more is inclusion, and I'll talk about that too. But in terms of access, that's what most people think of when they think about disability services and what we do in terms of accessibility. So that's things like accommodations for students that might have mental health or mental illness and need specific accommodations for courses, or even co-curricular things. So like Kyle and Residential Life, that we will also do accommodations. We also work with Hamry Center for Health and Wellness on making sure that students are also referred over for more supportive counseling types of care. But in terms of accessibility, we do both short-term and longer-term things. So maybe a student would come to us and say, I have this thing that is happening in my life that is really dramatic, it's traumatic, it's acute, it's happening right now. And I need some support just on a temporary basis and maybe some accommodations for classes. I need some additional time on something. And I don't really have a disability per se, but I've just got this impact that's really happening for me right now. So that's kind of the shorter term accommodations that we do. And then we also do longer term accommodations. So at times accommodations might work into more than 6 months or a year, and that we're thinking about ways that a student might be impacted, like they might need some additional time on assignments. Testing might be really significant for a student. We do that on a really individualized way. So what we do is we sit down with students and we have a meeting with them and we say, okay, how are you really being impacted here? Let's look at how we can think about accommodations for you. And then let's also think about what other support systems are in place for you. So that's not done really just even through documentation or through filling out a form. We really want to meet with students and figure out where their functional limitations are, and that's kind of a legal term. The other thing we do is a lot of educational pieces. So not only things like this, but we have Radical Mac Access that's coming up in April. So we do things like panels, we do educational things, even fun stuff. Like I hope you all saw that we gave out coloring books in the winter. So just trying to provide opportunities for education on mental health, but also just experiences that students can have just to take off some of the heavy lift that they have. We also have support groups that are available every 2 weeks. We have something that's called Virtual Gather for students just to get together that may identify as having a disability. And students as well on campus, just so that you know, the #1 disability on campus is anxiety, followed closely by depression. So, and then there's other support resources that we can provide to students too, if they don't necessarily want to meet with us, which we get. And then again, with the Hamry Health and Wellness Center, there's support groups as well too that we can tie in with them. And then the last piece of this is really inclusion. So we don't really want to silo students off or section them off and say, here's the group of people with mental health issues, and then kind of here's everybody else. We want to really think about inclusive practices across the board. So we're really big proponents of something called universal design. If a student is having a mental health condition, how can they walk into a classroom and have the same type of access of everybody else with really not asking? And that's something we're moving towards. We're not quite there yet, but we really look at mental health from an inclusive practice as well. So we do lots of stuff, but that's kind of the 4 pillars of what we do.
Thank you. And I remember, working in health promotion, I feel like I had an idea sort of maybe what counseling services does, and, figuring out what to say, talking with you about the panel. And I just remember I've told you in that meeting, I had no idea that all this was going on in disability services. And I just, talking with my friends afterwards is like, they don't know either. So it's so interesting to get it out there so people know that it's not just what you would imagine when you hear the word disability services. And then we will just go on to Kyle from Residential Life.
Sure. Thanks so much. Yeah. So I think I'll start by talking a little bit about just the makeup of our department in terms of staff, and then I'll weave in how various components of those staff, utilize different services to provide support for students, specifically around mental health. But just a little bit of background info for you all. For Residential Life, we have a variety of staff. So we have our resident assistants who are RAs, and we have about 35, 36 RAs on any given year, and they work with anywhere between 10 to 30 residents, depending on the residence hall that they live in, or the apartment or the suite area that they live in. Within those RAs, we have our resident hall directors, and those residence hall directors are all master's level education, educated folks who have background in education, a background in higher ed, and go through a lot of training and just identifying how we best support students and while they live on campus. And we have 5 residence hall directors at any given time throughout the year. And then we have our larger essential professional staff members who we have, like myself, 2 associate directors and our assistant dean for Residential Life. And between all of us, we try to have a really holistic approach in terms of how to support students with where they're at. We do that in a variety of ways. The first way that we do that is through our on-call and emergency procedures program. So every night, we have an RA on call, and our RAs on call serve our students in a variety of ways. Sometimes it's helping them with something facilities that's going on in their building. Other times it's working with students on an individual basis about a mental health crisis that they're experiencing. Oftentimes our RAs are the first people who will help a student call press 2, which I know is something we'll talk about later today. But then it's also not only in the moment supporting the student with where they're at and just being someone to listen, to validate their experiences, the concerns that they're going through, but then also identifying the immediate support systems for them and then the longer support systems for them. So like Julia was mentioning, Mac, there's a variety of different ways to create more like short-term and then longer-term support systems. Our RAs do that exactly, in the moment, to be able to tell a student, hey, I know you're going through something in the moment, and we also have some other resources for you that we want to make sure you're connected with folks like Melissa or folks in counseling services. And oftentimes our RAs will also loop in our residence hall directors who are also on call. We always have a residence hall director on call anytime that we have students on campus. And so between our RA, our residence hall director on call, and our larger Macalester on-call campus response team, we in Residential Life always have folks who are ready for residents and any experience that they're going through. And we provide a lot of resources for students in the moment when they need a little bit of support there. So aside from our staff, that on-call team that I mentioned, there's often moments where we'll work with students who are concerned for their friends or other residents and do a wellness check. That's something that we partner with public safety on. And just do a physical check, especially during COVID-19 when we're not all having that in-person interaction that feels, something that we're desiring a lot. But we'll actually have a public safety officer who is equipped with PPE, do a physical knock on the door and check to make sure that one, that they're doing okay, and if they want to or need to get connected with somebody. So that's something we partner and do in the halls. The other 2 things that I'll mention to you as support systems is we hold office hours with our residents. So our residence hall directors are always available throughout the week to chat with residents about any support that they need or any concerns that they have. Oftentimes that can be mental health related. Other times it could just be supporting students with something that they're experiencing on campus. And then the last way that we really try to meet students with where they're at is through a residential curriculum. And all of our RAs will have like a one-on-one conversation with the resident, or have a community meeting with them, or develop some social programs with them. And we truly try to have the approach with our residential curriculum to do an individualized experience for students, and knowing that there's so much that they're navigating in alignment with like the larger Macalester things, whether it's declaring a major, working with career exploration about an internship, or thinking about studying away. We know that all of our students are experiencing, how their identity impacts that, how their mental health and their physical health impacts that, how their leadership on campus impacts that, and so these are all things that in alignment with specifically the topic around mental health and supporting students that, our RAs and our residence hall directors are also implementing to support students on campus. So that's a little bit about some of the things that we do. Again, happy to dive in deeper with some of the questions as well.
Thank you for that. So speaking of questions, we have a bunch from students who may not be here, but students around Macalester just sent them in. Some who came from health promotion, things we get asked about often that some answers can be provided here. But first, just to quick check in, does anyone have any questions just based on what's been said so far? All right, that is totally fine. We have a lot of questions. So the first one, Julia, you touched on about being a short-term counseling often, but we've heard and talking to my friends in health promotion, we get asked a lot, why is the Hamry Center a short-term counseling option? And it's a point of frustration that we get told a lot. So we're just curious if you'd like to expand on that.
I would, and I love this question. So whoever sent it in, thank you. I also realized this happens to me every time. I get so excited about everything that I want to say, and I forgot to name one thing, which is we do also have the acute or same day Let's Talk program, which happens on Wednesdays, which again is no appointment needed and is staffed by 2 of our BIPOC providers. And I always leave out one in the branches when I'm talking about it. So why are we a short-term counseling model? And it's a really good question. And the big answer is because we want to really be as accessible and provide as much care to the students as possible. And so being a short-term counseling model allows for a lot of flexibility and allows us to do a lot of different things for a lot of different students on campus. So in our version of a short-term counseling model, and this is true for a lot of counseling centers in colleges and universities, is we don't necessarily schedule a series of appointments anymore. So again, a student is not going to come in and say, I want to meet with Julia every Tuesday morning. Part of that is because we understand that students' schedules are changing day to day, module to module, semester to semester. But we also understand that things come up in our campus, in our community, in our lives that might impact how we can and how we want to engage with care. So a short-term counseling model allows for that flexibility. It allows us that if we have, a student death on campus, or we have something that's happening kind of in our community. We recently had the murder of eight women in this country, right? Like, we want to be able to address those concerns. And the short-term model allows us to be accessible to students. It also allows us to see the full spectrum of what students might be looking for. So some students come to our center and they meet with a counselor once or twice. And some students come to the center and maybe because of what's coming up with them, they're working with a counselor for 15 appointments, and all of that is okay, but it allows for a little bit more agency from the student to identify what it is they're looking for and what they need. If they're looking for that more consistent care model, then let's really kind of support them in finding that off campus. If they're trying to navigate some anxiety that's impacting kind of their function or how they're hanging out with their friends or how they're interacting with school, then that's definitely something that maybe it's a short-term thing and we can like navigate it together. And maybe it becomes a long-term thing and they can always have that support on campus. And then the other thing is we abide by this college calendar. And so there are times when we are closed. We are typically closed during the summer break. We are typically closed during the winter break. There are other times when the college calendar has us closed as well. So that automatically makes us more of a short-term option for students because we are not that consistent piece for a lot of students as well. So the big answer is because we want to be as accessible to as many students as possible and to really allow the student and the counselor to work together to decide what is the best level of care that the student is looking for. Sometimes that's not us, and that's okay. We would, though, assist a student in finding what the level of care that they're looking for or what level of care is appropriate for them. We can be that bridge. But it's about figuring out what is the level of care you're looking for. And the short-term counseling model allows us that flexibility to explore that with students. Did that make sense?
Yeah, that makes a lot of sense when you explain it like that. So for the next question, it's sort of to everyone, because actually everyone mentioned they have sort of like meetings or drop-in hours or office hours or things like that. So just for someone maybe like myself who hasn't gone to anything, like what can I expect when I attend either my first appointment at counseling, or I attend drop-in hours, or I attend, office hours with residential life? Like what, just sort of briefly, what can I like expect when I arrive?
I mean, I can go, but I feel like you just heard my voice for a very long time. If somebody else wants to go first this time.
Sure, I'll jump in. So residential life, we have office hours, like I said, for all of our residence hall directors on campus. Oftentimes our hall directors will post those in emails that they send, or have that in like an email signature or something like that. I would also encourage any student who wants to just check in with their hall directors to send them an email. In that appointment, really it's going to start out super informally. I think like our hall directors just want to like get to know the student, and they miss those interactions, to be frank. Like I miss those interactions. I miss being able to like talk with students and getting to know them and hearing more about their experience on campus. So after, chatting a little bit, just to getting to know each other for a few minutes, our hall director is going to ask some questions, about, hey, like, so you reached out to me, like, tell me a little bit about what's going on for you right now. And oftentimes they'll start unpacking a little bit more about your experience. And then at the end of the day, they'll not only act as somebody who can provide some resources, but then also be a referral. Oftentimes in our department, we find that we may not have the answer, but we know who will have the answer. And so we'll often refer out oftentimes to folks on this call, Julia or Melissa or somebody else on campus, and then we'll get folks connected to whatever support they need.
Mm-hmm.
I guess it's my turn. I'm also learning things too. So thanks, Kyle and Julia. This is all great. One of the things that we did do this year was not only expand our drop-in hours on Tuesdays and Thursdays, so students can just come in between 11 and 1 and drop in virtually. And at some point, we're hoping that maybe that won't be pixelated and students can actually see us, outside safely. Like we'd love to be able to have that experience again and seeing your actual personal selves. But we also expanded some evening hours just because we recognize that students are usually in classes during the day, and that's really shifted. So we've also tried to be responsive to student calendars and just shift some night openings too. And when you come to see us, I mean, I think the first thing that we typically ask students is just like, what brought you here? I understand that many times when students are walking into my office, what is my typical day is their sort of extraordinary experience, that they're often coming in because they're feeling like I really need some extra support, or I've been holding this for a long time, or I had accommodations in high school or a learning disability or really, really overwhelming anxiety, and I haven't told anybody about this. And now I'm coming to you, Melissa, because I really need, or Josie or Shane, who's also on our staff, because I really need some supportive options. And so again, we kind of start with, okay, what's going on? What are the areas that this has really been problematic for you? We kind of break it down, often starting with classes, like how is lectures for you? How are testing? What about notes? What about, are you able to sit for a long time? What about Zoom meetings? And just try to break down and really figure out where students are at. And if they might have any history of disability in the past, and maybe they don't know that that's even a disability. One thing I like to mention is many students don't know, for example, if you are in recovery. So if you are a person that has had some addiction in the past and currently in recovery, that actually you're protected under the ADA, the Americans with Disabilities Act, as an individual with a disability. So we walk through that with students. We walk through how to register with our office. We talk about some things like confidentiality. We also may do a referral, but it doesn't end there. And we're not just accommodation plans. And I want students to know that they can also circle back around with us and say, I may need some help following up with my faculty, or I just don't know how to navigate this, or note taker, like Otter AI, what is that? I need some technology help. So it's really varied. In my day-to-day, it's everything from student walking in saying, I need a note taker, to students saying, I'm in high crisis and I'm really afraid for myself. And then we do some different things, of course, in supporting that student. So I think it depends. I like to say we sort of meet students where they're at, both physically, literally, and then also with time schedules. We're trying to do a better job with that this year. So come on over and I guess we don't. We used to like to say we have candy, but we don't this year. But I have Jack the cat. Jack the cat loves to come to Zoom meetings. So
That is candy right there.
he's awesome at his job. He really
I love
is.
it. I will do a shout out as I answer what a first appointment looks like for us to Health Promotions, who actually just helped us make a video exactly answering this question, because I think it is very intimidating sometimes if you've never done it before. Like, what is this going to look like? But a first appointment at counseling is very similar to what you've already heard. You know, we are a confidential resource. So anything that is shared with us is a protected conversation. And so we really talk about what that means, what that looks like. We validate for students, like, this will not show up anywhere. No one can, no one can know this happened. You are a legal adult. So we talk about confidentiality. We spend a lot of time just it's a conversation to kind of figure out, who are you? What brings you in? What concerns do you have? What questions do you have? We might ask the students some questions. They might ask us some questions. I always like to let students know if there is anything that you don't want to answer, anything that you don't want to share, that is also okay. I think sometimes students are worried that, like, you're going to ask me certain things and I have to answer. No, it is a counseling session similar to what you've already heard. Like, this is your time. So we really want to see, how do you want to use this space? How would this be most impactful for you? And if the answer is, I don't know, that's okay too. We can help explore how that time and how that space would work well for you. And then at the end of each appointment, again, because we are a short-term model, we always like to talk to students about what would make sense next. Would a follow-up conversation with me or another counselor make sense? Great, let's schedule that. Would talking to somebody on our medical staff about a medication or a physical concern make sense? Great, let's figure out how to connect you there. Would talking to Melissa or connecting with your hall director make sense? Great, how do we do that? So that first appointment is really just about kind of creating a space to talk about what counseling looks like, to create a space where the student gets to really explore why they come in, for them to talk to us about who we are and what we can create, and then to work together to figure out, okay, now that we know what our goals are, what are the resources that would help with that? So that's kind of what a first appointment would look like. And that would be a first counseling appointment or a drop-in. We kind of treat those very similar.
I think those were all fantastic answers. It sounds like the common theme among everyone is just sort of agency. You come in and you have control to say what you want and, figure out what you need next. And, sometimes you don't know, and it's helpful to have people who can help guide you to figure it out. So thank you for those answers. The next question, yeah.
Can I just add one extra thing? Is sometimes I'll have students that will come in and say, I don't understand the difference between disability services and counseling too, because it might feel like you come in and that we're talking to you and we want to get to know your humanness, but we're sort of the tasky end of things. That's the way I like to describe it, is that counseling is really the heart and soul. And I mean, these are layered, like we don't just come in and say, what are your accommodation needs? But certainly that we also then will follow up on things like, well, what kind of access points do you need? And that's where things like accommodation plans come in. So I like to think of it as sort of this thread that weaves through all of our support systems that really is, our goal is really to support students, and that may be a little bit different in disability services and how we execute it, and or in residential life and how that shows up. But I think what we can all name is that thread of support is really here at Macalester for students across the board. So if you come to any one of us, we can connect you also with somebody else if that needs to happen. There's many, many points of entryways into this thread of support that exists.
I think that's great to hear, because sometimes just across campus, I get sort of like the vibe, so to speak, that they're doing this, and they're doing this. And it's just everybody's doing their own thing, but to know that everybody's sort of actually collaborating, working together to try and, make better support systems for students on campus. So one of our, another question that we received is, for students living on campus, who should they call when they or a friend is having a mental health crisis? And what typical or sort of responses can they expect from that?
Mm.
Whoever wants to jump on that one first can.
I can start and then would lean on any other insight that these two other folks have. So I think of, there's a lot that could happen, I think, in this type of scenario. So I'm gonna dissect it to me, and there, it's not, you know, clean, but like 3 different types of potential situations. Because I think, you know, especially now that we live in a virtual world, you know, there may be a concern where your friends in a different room, you haven't seen them today, like, you know, and so that might be different than like you're literally in their room right now and they're having a mental health crisis. So I would say that the first thing is we have, like I mentioned earlier, our RAs on call and our hall director is always on call. And so I think our RA on call system is always a great place to start. These are, again, students who are ready to talk with their peers and their other students that are in the halls, and also able to refer to another, you know, hall director on call or somebody else in case there's further support that's needed. That's a great place to like start if maybe you don't know who to call. I would say if you or your friend who's experiencing a mental health crisis is aware and able to use Press 2, I would say use Press 2. That is, again, a support system that, you know, they're available 24/7. And we as campus partners who serve on an on-call team have relationship with folks who are on and utilize Press 2. And so if there's ever a concern that needs to get relayed, you know, we have communication with them. And so it's like one additional layer that a student doesn't have to navigate, but like just know that there's further conversation that's happening. So I would say Press 2 is something else. You know, that could be a scenario where if you are with somebody who is experiencing a mental health crisis, or you yourself are experiencing a mental health crisis, you know, Press 2 is great for that. I would also say if you are concerned about a friend who is experiencing a mental health crisis, you may not have seen them, you can't see them physically, like public safety is also a great resource to go get conducted a wellness check that I talked about earlier. Again, they can go see them in person, you know, call the hall director on call, call staff member at Macalester to talk about them. So, and I want to acknowledge too, like there's obviously a lot of stigmatizing around like public safety, police officers, and, you know, student interactions on college campuses, and that's real and 100% true. I also will say our public safety officers are Macalester trained and staffed. They're not contracted out officers that we have a relationship with someone else in the cities. So they do receive a lot of specific training to meet Macalester students' needs. And I know that's something that they've been focusing a lot this past year as well. So those are a few things I would say that are resources for, again, if it's you yourself who are experiencing mental health crisis, or you know somebody who's experiencing that in the moment, kind of a few resources that could be available.
Yeah, I think those 3 are like the primary, especially for on campus, because those 3 can all are on call and all have access to additional supports on campus, which is really, really great. I just wanted to emphasize Press 2 is great if for you yourself, or even if you are in a different state, but heard something from a friend who is on campus, you can call that and get support for yourself. And you can also get support for your friend. And I think that's really important to understand, is sometimes students and anybody just doesn't know like what to do. And it's nice to have an offering like Press 2, because you can call for your own support while supporting somebody else. And then the only additional thing I will say about public safety is not only are they Macalester employees, and so they are trained and they understand our community, but they are also doing a lot of work specifically to be trained on mental health crises and providing mental health support. Which is not your standard. It's changing, which is great, but has not been the standard for public safety and for police involvement in general. And Macalester's public safety in that department has really made that an emphasis. And so that's just something to know. I think a lot of times people think of public safety for physical concerns, or, they're worried about their friend's health in the physical sense, but our health and wellness is also our mental health and wellness. And they are really focusing on that, which is great. So yeah, Kyle, I totally love that list that you created, both during daytime hours and after hours. I think that's what's also really nice about those three options, is that they are available all the time. A student is more than welcome to reach out to our office to do a drop-in, to do a same-day appointment. If it is during the time when our office is open, we have somebody on the phones. They can email our direct line. So please feel comfortable to do that. But the three resources that Kyle laid out are available 24 hours a day, which is great.
And I also want to throw in something here too, and this goes back to public safety, that public safety also isn't a stopping point. So we have a campus response team that are made up of professional staff members, and both Kyle and I actually sit on, we're one of the people that you're going to maybe get if we're on call during that time. And so our jobs really are to support public safety in that work, but often they will call us, and also for students who are off campus. So if you're living in California or Oregon, and you don't know what to do or who to call, that public safety number can be the first line of a place that you can go to. And the campus response person can also help you get to the right space. So I certainly have been on call and referred people to Press 2, or referred people to going to counseling because they didn't really know where to go. And then we collaborate with them and sort of figure out what the next step might be. I've done everything from referring people to a phone number to helping really triage with a student to get them to right now kinds of care. So I want you to know about that team too, that there's a whole group of people that really have, again, that thread of care, that are really there, that are experienced with managing those types of situations as well.
Mm-hmm.
As I said, for all the questions, these are great answers. I mean, I've spent all of this sort of pandemic time on the West Coast, so I've really sort of felt like isolated from all the resources. And like, what do you do when you hear things that are going on with your friends in Minnesota? So it's just sort of great to hear that, like, these things like Press 2 or the numbers to call, they're still available for people like me who aren't in the area.
Mm-hmm. Mm-hmm.
Another question, I'll just read it off of here. What resources are available for students whose mental health is actively worsened by Macalester structures, such as like the way courses are set up? And then there's a follow-up to that, but once we hear an answer, I'll come back to that one.
I'm feeling like, Melissa, you might be a good starting point with this one.
I'm nodding and just feeling that for a moment and understanding that space. I mean, certainly, I'll also just name that our the number of students that we've worked with have just gone up extraordinarily because of the pandemic and because of other impacts that we've had of, want to name that there has been death, there have been murders. We have seen George Floyd. We have seen recently AAPI identified students, that these bubbling up of these really crisis situations have had a huge impact on students. So I don't know what to do about the module system at this point. I mean, we are almost done. We're at mile 19 of the marathon. Like, we're going to get through this, and it's going to change for next year. But I think we've done a lot of support in just trying to figure out with students, okay, do I need an extension of time? Do I need something in the system that changes? And it might not even be a formal accommodation, but it might be that we're working with faculty on kind of trying to figure out what works for that students, or that faculty feel like, okay, well, I can shift this for my whole class then. So we've done a lot of that this year. We've done kind of a lot of that, that not so formal accommodation piece, but just trying to navigate with a student where they're at currently. It might be for a couple of weeks, it might be for a week, it might be longer than that. Or so I wish I had a super great answer to that, right? Like, we're on a boat and we're kind of on this ocean, and I feel like we all got put on different oceans, and then sometimes our boat gets set on fire. And so I think the best thing that we can do for this year is trying to find those spaces of folks that we can count on. And for us, it's been navigating how to work within courses. And that's even been a lot of emailing sometimes with faculty or trying to figure something out for a student. So I will also name that I have said I don't know more than I ever have in my professional life. I've done this for about 20 years. And these are times that also they weigh really heavily on us and our staff too. Like we all experience and take this on as well. So I don't have a great answer. I can just tell you that we're in it with you. We kind of go case by case. I don't know. Kyle, Julia, you got other things?
The one thing that I think it's such a great question, because the reality is things happen that impact us, right? I mean, that for me was the core of the question of like, there are so many things that feel out of our control that impact us. And so then how do I navigate that? And I think from the counseling lens, like one of the things that I think we think about is how can we take those things that, you know, we can't control necessarily what happens to us, but we do have agency in how we respond. And so really working with students to explore like, okay, yeah, like this is a really hard situation. First of all, like validating, like, yes, this is a really hard situation. What are your choices in this situation? What is available to you in this situation? And what agency can you have, or do you want to have in this situation? And sometimes it's the response of like, I am too tired to figure it out. It's like, okay, then what's the team that we can come together? That idea of like, who can we reach out to? Sometimes it's, I just needed to tell somebody that this is really hard for me. And like, I need to come back next week to tell you that it's really hard for me. It's like, great, let's navigate that. And sometimes it is some of these other options, like getting an accommodation or withdrawing from a class or taking a leave of absence to figure out like, what do I need? What do I want in this situation? There are multiple choices. And sometimes when it feels like there's so much happening around us that we don't have control over, how can we come and focus on what we want our response to be and what we do have control over? Because unfortunately, there is a lot that we don't have control over right now. So a lot of what Melissa's saying, like just sitting with a student to understand like, yeah, we can't change that, but how can we bring some agency into this situation? Or how can we find resources that may support you in this situation that is unique and hard and challenging? And no, you did not ask for it, but it's here. And now we're going to navigate it together. Because all of us on this call, right? It's that idea of students knowing that they have a partner in that. They're not adrift in their boat that's on fire, right? The rudder might not be working, but we're gonna paddle together. We're gonna help you as best we can. But that's kind of where I went with the question as well. That idea of like, yeah, it's the reality of sometimes just being an adult is that things happen that we have no control over, but then how can we how can we respond to that?
I want to add something to that too. Yay, Julia, that was a great response. Lots of analogies here about boats and running and whatever. I've used them all year long. All year long, I've used them. The other thing is, and I really truly mean this, I know that students have heard this again and again, like resiliency and change, and we're going to move to better. But I do believe that. I think just from my lens of working with students with disabilities, and as we talk about universal design for things, we are definitely learning some things that we've been actually arguing for a long time. How to be more flexible with things, how to open up testing so that more folks can have longer time periods for that. Like we're really moving towards that idea in ways that prior to the pandemic were always accommodations. They weren't things that were more integrated in classes. So I think that we've got an opportunity here. And I think that students have the lead in this. They really do. And we'll go along with you. Like we will be your companions on this journey as well. And your support systems and your cheerleaders and your help in that. But I just want to name that I've also seen students do some really great things and come up with some really fabulous and creative ideas in this time of struggle too. So that's really exciting to me. And I mean that seriously.
Yeah. And I don't have much more to add other than to what Julia and Melissa said. I think the one thing that I'll say is, coming from other colleges and universities that I've worked at previous to Macalester, there's a reason why every staff member at Macalester works at Macalester, is because they love what they do and they really, really care for the students who they work with. And so I I will just offer that, and like to all the, you know, insert analogies that Melissa and Julia were also alluding to, like they're truly here, and we are all truly here for you to find out how we can support you, whatever that looks like. What if that's literally just listening and saying, yeah, this is a lot that you're going through right now, and I don't have anything to say to help you, but I'd want you to know that like what you're saying makes a lot of sense, and I see how you could be feeling this way. And even if it's just us doing that, we're there for you. And whether office hour, email, call, Zoom, whatever, hopefully an in-person, physically distant, you know, chat outside, right? And so I just want to emphasize that, because the people who I work with at Macalester, like they care a lot, and they mean it, and that's authentic.
Just to sort of segue on the whole aspect, like students-led, student agency. So Macalester students, we don't, you know, sit back on our hands. We don't watch things. We take action. We try and make changes that we want for the betterment of ourselves and our peers. So just sort of going off that question, and maybe stepping out of the module system and trying to imagine just something in a more normal, I say with a laugh, yeah. So like, what advice would you give to students who want to address this at the structural level, and not just for personal situations? Like, who are the allies on campus that we should be contacting and reaching out to try and start up these conversations to make, you know, changes regarding mental health and things that are making it better or worse on campus?
I can
I think,
start.
go ahead.
Oh, okay. You muted yourself first, so I'll go. I think something that I've learned a lot is that oftentimes the biggest challenge is often knowing the right person to talk to. And so whoever you feel, you know, closely with in terms of like, you know, it's a student employment position, if it's like a worksite job, you know, whatever that could be, ask them who is the right person to talk to and see if they can help you get connected. I think that's one thing that I'd say. Like, for example, you know, in terms of residential life, whenever there's like a long campus partner, you know, collaboration or partnership, I'm usually the kind of the point person for our department to at least start and like initiate those conversations. And so as students, anyone who's watching this video, if there's anything that you're thinking about more structurally in terms of like a collaboration within departments, you know, I'm the person who you can reach out to. And so like, I think a lot of times for us, it's just finding ways to like bridge that gap a little bit. So like you said, Carina, like you just know how you can like get that ball rolling a little bit and to be able to like get things going. So that's one piece of advice I would say is try to like, you know, pick and poke people to find the right people to really can like help you move things forward or listen to you and find out the right areas to be able to like incorporate any ideas that you have.
I was waiting to see if Melissa, see, then she did. Tricky. To add to that, I'm just going to add a little is I also, I come from a grassroots background. And so for me, it always makes more sense in my head to start and move up than like try and do the big thing. And because it can be very overwhelming and hard, and it's hard to change. It's hard to change systems. It's hard to change, to make big change. And we've seen that in this last year in particular, it's just hard to make big change. And so I really think if there's something that you feel you need or something that you think the community needs, finding not only that person, but starting in an area where you feel like you maybe do have some agency. So maybe a department that you're a part of, or maybe a student group that you're a part of. Or maybe if you have a couple friends who are part of different student groups, right? Like bringing these groups together, but really starting in a place where you feel like you do have some agency and then reaching out to the people within that group to kind of build it that way. I just find that it takes a lot of energy to make change. And so if we can make change in ways and talk to the people that will help us kind of move up, that kind of conserves our own energy versus trying to like go to the top of Everest right away. So I think that would be kind of my thought is think about what communities you feel safe in, what communities you have agency in, and what communities you feel like you already have a voice, and start there. And then see where those conversations can take you.
I think I'm going to reiterate what both Kyle and Julia have said too, is that when we think about change or structural change, And even when we think about something like social justice, right? My definition of that is what you do kind of every day in the small day-to-day steps. So my first point, I think, really to you, Carina, is how do you know that students aren't doing that? Because I'm seeing them start to make that move and that change. And since I've been on board since about, what now, 2018? Is that when I started? I'm a junior at Macalester. So I mean, I've seen that change really happening. So it's everything from talking to a faculty about, hey, I need more of this, like this really helps me, that creates space for other students too. So being sort of an ambassador for that, or even just doing your own reach out to your own friends, like learning how can I support a friend within this space that right now. So aside from the professional help, what are the things that I can do to support somebody in this space right now? Because right now we're all weighty and all have anxiety, depression, or all have to navigate that. So I think it starts with where you are and then just figuring out the small pieces, the next step. Yeah. And I'll sometimes too, I'll go through with students and sort of figure out what that might be, because that can feel like a lot. Like I don't know what the next thing I need to do here. And I think that's all of our jobs, is to help students figure that out.
Yeah, that was a great answer. I liked the grassroots answers. Sometimes it can feel so big to try and change, everything, and figuring out who to talk to. It all sometimes just seems like a lot. So I recognize we're getting close on time. So one of the final questions, it's sort of a hard hitter in the sense that in health promotion, I work a lot with mental health, and this is not the first time a question like this has been asked. So I'll just read it word for word. In what ways does Macalester actively resist forced institutionalization in the presence of policing in the context of mental health? If it does not do this, what concrete steps would you recommend students take to insist on this becoming a priority? And I know take as much time to think about it. It's sort of broad, but it is something I've seen come up in my years working in health promotion. It's come up in various ways of questions students have.
Do you mind? I'm such a visual person. Do you mind? I don't know if I saw this, and that's just how
Would you
I
like me to
think.
put it in the chat?
Chat.
Yeah.
That would be really helpful for me. Thank you.
Let's see here. There, it should be there.
I think in this, one of the things that first came to mind for me is, can you give me an example of this? So the forced institutionalization, for example, I might have a thought about that, but is there an example that you're thinking of with this?
Similar, I don't quite know the forced institutionalization part, but I would guess that means, mental hospitals or things like that. But I've also seen it come up as like forced leave of absences, things of that nature. That's how I've also seen it posed in the past.
I feel like I'm talking whoops. Hear me now? I feel like I'm talking a lot here. But I think that one of the things is just from being on the campus response team in terms of actively resist forced institutionalization. I want to make it clear that if we're sending a student to a hospital for immediate right now care in that situation, that's the last step of something, not the first. And so, evaluating that student, being able to talk to them, figuring out where they're at. I mean, there's lots of steps before that happens. And also, even in just getting a professional to evaluate a student, I mean, sometimes what happens is we might have a professional that does that work, or even at the hospital, and then the student might come back to us, meaning that so we don't have a lot of barriers for you, like you have to provide this documentation that says you're good enough to come back, or that you have all these, like, that's not our goal to do that. That our goal is to provide immediate care and not to keep students in those spaces. And so to make sure that they're either coming back into our space and then getting the help that they need. So there might be there could be some misunderstanding about that. And I've worked at other institutions too that are pretty stringent about the requirements for things. Do you have something to add to that, Kyle, just on that piece? And then I can talk about some of the others.
Yeah, I think the one thing that is coming up for me as you talk about that, Melissa, which is, I really appreciate you outlining that, is there's a problem, there's a reason why we're reaching out a lot. Like, like oftentimes, whether it's residential life, disability services, Office of Student Affairs, there's a lot of departments that'll reach out, whether it's email, phone call, I would say Macalester actively resists this because there's so much outreach that we try to do ahead of time before it could even escalate to a scenario that Melissa talked about. There's a lot of things that we do that, I can imagine if I'm a student, I'm seeing somebody email me 3-4 times in a week, that it feels like it's a lot to manage. And there's, that could be a huge reason why there's a lot of mental health struggles there. But there's a lot that we try to do ahead of time just to check in with students, to find out what resources we can provide, to find that short-term care, to find out what long-term options are available to you. So I think that's just something I'm thinking about, Melissa, as you talk about, there's so many steps that are taken ahead of time. Oftentimes the communication, and oftentimes possibly perceived as over communication from departments on campus, is some of that. And that's a way that we want to try to be really active to try to have a student be supported before they potentially have to be in that situation in the future where hospitalization is something that would be an option. So I just wanted to add that.
And I just wanted to name, and I thank you for putting it in the chat, because again, I'm such a visual person, so it's really helpful for me to read over the question. I want to honor that many, many communities in this country, many people on our campus have had negative experiences with healthcare, with mental health, with seeking help, with asking for help, with naming a concern, whether it's a family judgment on mental health, whether it's, they said something at school and something bad happened. I really want to honor that, because that, I think, is a big part of, I can only speak for counseling. I think that's a big part of how we approach our work in counseling, is honoring that everybody is coming to us with a different experience. And unfortunately, for many people, that experience has not been positive. And so when I see words like forced institutionalization, that's what comes up for me, is someone's agency being taken away within asking for help or asking for what they need. And I also want to honor that with mental health, I think there's still a lot of stigma around mental health, and I think that's changing, but I think it's still very present. It's still very present for a lot of our students. And I want to honor that we have students from the entire globe, and who come from very different backgrounds. And so I think this is a really important question, because I think it's important to honor those experiences and to really name it. And I really appreciate Kyle and Melissa naming the importance of options. And the option to go to the hospital is only one that, first of all, we would give, and then we would only take that away, that option of, do you want to go or do you not, if there is an immediate safety concern. Our students' safety is the #1 priority, and that is full safety, mental, emotional, and physical health and wellness. We want to give as many options as we can. We want to give as much agency and choice as we can. And I think that's something that is still, I think we always need to advocate for it. We always need to advocate for agency. We always need to push back and say, hey, is this really a choice, or do I feel that I have to make this? But in our office, we don't do any mandatory counseling. Nobody comes to our office because they were told to, or they're being punished, or they can only come back to campus if they see it. That's not true. There is no mandatory anything. Students will always have a choice in our office, unless there is a concern about safety, and we will always have that conversation with the student before we force anything. Nobody wants a student to feel like they don't have the choice or the agency. So when I read that question, that's really what's hitting me hard is, unfortunately, in mental health and in physical health, many people have not had good experiences. So my goal, and I think all of our goals, is to make sure students feel that they have agency and choice. And that's how we're pushing against, and that's how we're changing the model, is allowing students to understand, oh my gosh, my body, my choice, my mind, my choice. Like, yeah, it's your choice. Your wellness is your choice. So how can we support you in making that choice? Yeah, those are really important words. And so I'm just holding that.
And I also have to say, like, we are also improving. Did we just have a conversation about this today? I mean, we're always talking about this just in terms of mental health and response to things, in response to those emergency situations for a student. If it gets to that point, like, how are we doing this well? How are we not doing this well? How are we working with public safety? So we also understand in this that we are also learners and along on the journey with folks, and that many students have come from experiences that have been really negative. And so I also just want to name that we are still learners and growers and improvers in this too. Yeah.
Thank you for that. And hopefully people watching it who've been questioning this or wondering about this will bring some information that they were searching for. So being respectful of time, we're sort of out of it. And so I just wanted to say thank you to Julia, Melissa, and Kyle for coming on the panel and sharing information with us. I know so much was learned today that I didn't know. And so thank you very much for being here with us today.
Thanks, Carina. We really appreciate it, and to everyone too. And I just want to say, we're here. We're disability services at macalester.edu. Email us. We will be happy to chat with you and get you set up for things if you need it. So we're around.
Ditto to that. Yeah, thank you, Carina, for hosting us. Thanks everyone watching, and residential-life at macalester.edu if y'all need anything or have any questions.
And I'm just going to keep saying ditto. Really grateful for this opportunity. And we go to our website. Myself, you can email me directly. You can also schedule an appointment right from our website, as well as all of the resources that we talked about today. I know there were other questions too. So again, feel free to direct those directly to me. If anybody watching this has a question, I'm on our website. I'm the only Julia.
Okay, I will stop recording.